Hi, my name is Corrine Maury. I'm a terminated nurse from Nelson. I want to just be able to explain some of the things that I have uncovered in the last year. I've been quite involved in networking with other terminated nurses, legal teams, etc. And so I just wanted to share some of the information that I have. And I don't want you to get super caught up in the whole vaccination thing because there is a bigger picture at play here. But the mandatory vaccination thing was a tool that was sort of used to start pushing things in a certain direction. And so I just wanted to let you know some of the things that I've come across. I'm not a lawyer. I am just expressing my own opinion, and I hopefully will be able to just give you some facts that you can look into yourself at some point. When all of this mandatory vaccination came through, it became challenging for many nurses because it created an ethical, moral distress issue. We are very much aware of ethical guidelines that are to be used in protecting patients' rights and individual choice and autonomy. This is through the BC Medicare Act. It's through our colleges' ethics and standards of practice. Even the Human Rights Commission has statements. There are policies with all the employers. So there are many levels that we are that are there in place to protect you as the public, to make sure that you have your rights to personal choice and autonomy in medical decision making. When the mandatory vaccinations came out, this became problematic because many of us were seeing that there was already infection occurring among double vaccinated nurses, and we were seeing side effects. And so anyway, there are legitimate reasons why so many healthcare professionals refuse to get the vaccination. I think it's important to realize that as a professional, when we go into the workplace, our personal person and our personal opinions no longer matter. We have to operate as professionals. And so when we enter the workplace, all of these guidelines are in place to give us direction on how to take care of people. So this became a problem when some of the decisions that were coming down were in direct violation to protecting those interests. So I want to just sort of explain too how when nurses get hired, it's mandatory that we have to become union members. And so there are two nursing unions in BC, the BCNU, which is BC Nurses Union, and HSA, which is the Health Sciences Association, I believe. And then in terms of our representation, when we become union members, we no longer have the authority to speak with the employer about any employment conditions. That right has been given to the union, and they are now the legal representative for us to work through any kind of employment conditions. There is a single entity called the Nurses Bargaining Association that is over both of those unions, and they are responsible to do the collective bargaining that happens because it's a contract every 3 years that's renewed between nurses, other healthcare sectors, and the employers. So Nurses Bargaining Association is the entity for over the nurses. And then for the employer, which is all of your health authorities, and there's over 200 organizations that also provide healthcare, their single entity that works out their side of the collective agreement, all the labor relations issues, is called the Health Employers Association of BC, which is HEABC. When the provincial health order came down from Bonnie Henry requiring mandatory vaccination, this was problematic. So I don't know if you're aware, but in 2015, the Ontario Nurses Union, or association it's called, but it is the union, took the province, Ontario province, to court twice, and there were two arbitrator rulings over an issue where nurses were required to either get the influenza vaccination or wear a mask for the duration of the influenza season, which would have been 5-6 months. They were able to scientifically prove that the surgical masks were ineffective at keeping transmission of influenza down. Surgical masks within 5 minutes, I believe the moisture buildup makes them ineffective. And so then it became, the decision with the arbitrator was that there was enough scientific evidence that they could strike down this imposed mask wearing, and that it was actually just coercive and punitive against nurses for making them have to wear this. As a result, BCNU, you can go into all their bulletins from the year of 2015 on, every year, they have put out bulletins where they state that BCNU has always been opposed to mandatory flu vaccination. I know that some people will go, well, COVID is different. Actually, they are both respiratory infections. COVID was monitored worldwide using influenza surveillance systems, and it's just a different virus. All viruses eventually evolve to a place where they become more contagious but less severe. That's how they are able to stay alive. And so then this is actually what the COVID virus has done as well. So what we have now is our union has taken a position since 2015. They're adamantly opposed to imposed flu vaccination. And they eventually took it to what's called an IWAD, which is an industry-wide application dispute. So they challenged the BC government and the provincial health officer, who was Bonnie Henry at the time, and they brought in scientific evidence to show that forcing masks and mandatory vaccination was ineffective. And in 2019, when the latest collective agreement was made, they also won that challenge. And as a result, then it became, in 2019, the BCNU has succeeded in ensuring that the professional judgments of nurses is respected through this agreement with HEA BC, and they have amended the mandatory flu vaccination policy. So what this means now is that we can make sure that nurses will no longer face discipline for not getting a vaccine or for not wearing a mask. They state very clearly that vaccination is one tool that can be used to prevent transmission, but we also have to have adequate staffing, infection control policies in place, and you actually just isolate the infectious parties. So this now became a legal policy and part of our employment conditions that nurses could not be disciplined for not getting the mandatory vaccination. They also then created a new policy, and I want to just read it verbatim so that you can hear the position that the BCNU took. So, like any medical treatment or procedure, each individual must have the opportunity to inform themselves of the potential risks and benefits of immunization based on their understanding of the evidence and in discussion with their care provider. Employers should work with nurses and other healthcare workers on developing supportive vaccination policies to achieve high vaccination rates in the healthcare workforce. Evidence shows that punitive or coercive vaccination policies in workplaces can create conflict. It can damage trust and may unintentionally heighten vaccine hesitancy by feeding into narratives around vaccine safety. employers should be working with nurses who are unable to be vaccinated to ensure that they have access to work. Nurses in BC have a unique opportunity to educate the public on the risks and the benefits. Actually, we were not given that opportunity. We were silenced pretty quick. Okay, so I just wanted to bring that up because it shows that BCNU did actually have the power and the authority to renegotiate with the BC government policies that were shown to prove that it wasn't in the public's or the nurses' best interests, okay? So you can actually Google all that information yourself if you need more. Now we get into nurses being terminated. Now, historically, anytime a termination occurs for a nurse, it will automatically go to an expedited or full arbitration within 90 days. That is their policy. That is historically what has happened. What we have now is we have thousands of nurses who have been terminated, and currently we are at over 300 days of having a grievance started, and our union has done nothing to progress these grievances forward. Now, back in the fall, there were a few statements from Adrienne Gruel, who was the vice president of the union, that we cannot afford to lose one nurse from the bedside. We're already at critical nursing shortages. And then the president, Christine Sorensen, resigned, and they had just hired CEO Cody Hedman to do all the bargaining that was supposed to be coming up this year. He took a leave of absence, and we started to see many staff in BCNU take leaves. So they were at shortages while we're at the biggest crises in nursing that we've ever encountered. We, as terminated nurses, understood that our union was going to fulfill its obligation in terms of protecting us. Now, also as well, we had just gone through an episode where the union had fought for this change in the influenza policy. It was there. It was part of our contract, okay? Now we're getting terminated in violation of our collective agreement and in terms of this policy. Now, this happened under the public health order's emergency conditions. And so the public health order was, in fact, the authority at that time. But it doesn't change the fact that BCNU had a responsibility to challenge that. They historically had challenged it. They could have challenged it. And yet what we've seen is they have just remained silent. In fact, they won't talk about us. They're every day out walking saying, hey, we've got critical nursing shortages, and they won't talk about the thousands of nurses that they haven't represented. So now we have an issue with the public health order itself did not state that healthcare workers had to be terminated. They just said that they couldn't work. So what we have now is actually, remember this HEABC entity I was talking about? They informed all the employers that they had to terminate. So here we have this body, HEABC, which is run by a board of directors. And interestingly enough, the president and the vice president are both appointed positions. I'm assuming by the BC government. I haven't been able to track that down. But both of those positions were appointed in 2018. And it was this board of directors who told the employers that they had to terminate, which was in violation of the collective agreement. This then should have initiated right away a response from our union challenging this, putting in grievances. They actually have the ability to challenge things legally, and yet total silence. So trying to get accurate numbers, I do know that the college, we have to pay for licenses every year, $700. The union reimburses just over $200 for each nurse that gets her license. I noticed that this year there was over 4,000 less applications for this than previous years. We do know that many nurses went into early retirement because of the coercion. Many went on leaves, and nurses are still getting terminated as they come back from leaves. And we know there's at least 2,000 to 3,000 that have been terminated. So we're seeing that there are currently about 7,000 to 8,000 less nurses in the system than last year. We have to rely on the union to do its job. And so what happened, these are just things now that I've noticed. I can't tell you what's going on here. But when that CEO resigned, a new one named Jim Gould was put into position. BCNU uses a legal firm, HHBG, and this Jim Gould is one of the partners of the legal firm. He has moved into the CEO position. He did that in January. So he was not present with us previously when all of us nurses worked through the pandemic, used our PPE and showed up for work, and none of us actually died while we were doing this. And so now this new Jim Gould guy is basically the head of all the negotiations for the union. Now, we've been to meetings with BCNU and Job Action and trying to get information on what are the discussions that are occurring between the union and the government at this point in time. We're always told the only person that knows that is Jim Gould. The executive doesn't know what's going on, the regional executive. There are no discussions. The only person that has any information as to what's going on with the legal team and the government is Jim Gould. Now, we have a letter from Jim Gould last February, and he said that while this declaration of a state of emergency is in effect, the union has no reasonable recourse that it can take other than we will just take your grievances and file them. So he said that we could spend a significant sum of money in litigation to fight the mandatory vaccination mandate. But in discussions with his colleagues, he feels that this fight would be almost certainly lost. My issue with this is Jim doesn't get to be the judge and the jury. Jim's job as BCNU is to represent its members, and we have paid member fees to get adequate representation. The fact that BCNU actually did challenge the government in 2019 and won shows that they can actually do this. But instead, Jim Gould's position is, he doesn't want to spend money on this. So now what we have is we have a problem where we have members who are paying fees and then they are not getting fair representation. This actually starts moving, in my opinion, into areas of extortion and fraud. So now we have discovered, we've had 150 nurses as a group that have been compiling information, documentation over the last year. And what we've discovered is that the union itself does not actually have any legal counsel. They have labor relations officers who are generally nurses that have gotten training in the area of labor relations, but there's no actual legal counsel with the union, even though the whole point of that union is labor relations and employment law. Okay, so now we have a time when all these nurses are getting terminated. The union actually had to hire outside parties, labor relations officers, to come in and do the grievances. And then in violation of their own time frames that they're supposed to move these forward, we have now discovered that over 300 days into our grievances, they have not moved forward at all. So there has been no formal documentation of any of our evidence. There has been no reaching out to us to compile that evidence. Everything has gone into limbo land. And so we get these generic emails that state, well, we may or we may not take this to arbitration. We may or may not put this into abeyance. This is being moved to the next step of the grievance process. Well, which step is that? And this could take 1 year or it could take 2 years. Well, actually, it could take forever because they have not moved forward with any action for us. Now, I'm not asking you to take sides for our issue. What I am trying to do is highlight to you the fact that we have a union with apparently over 48,000 members that has access to resources and is refusing to represent its members. We have an obvious breach of the collective agreement where HEABC has imposed terminations that were not specified by the public health order, that there were all sorts of things in the collective agreement in terms of accommodation, duty to accommodate, different things that could be done while we work through this emergency. And as a result, and there has been new evidence coming through all the time. I've done freedom of information requests, and through 5 health authorities, I've gotten 3 responses back. And after November 30th to June 30th, so after terminations of all the unvaccinated, there were already over 13,000 COVID sick calls from staff just in 3 health authorities. I haven't got the information for Ontario Health or Island Health yet. So we know that the vaccination did not stop transmission. I also have an internal Interior Health email that in July, August, they were now normalizing the COVID virus in emergency triage situations, and it's being treated like any other virus. Yet we are still not allowed to go back to work. So now you have this whole migration of healthcare workers, not just nurses, but doctors are going as well, who are headed to other provinces. Alberta rescinded their mandatory vaccinations. Saskatchewan never had one. We're the only province still that has enforced this mandatory vaccination. And as a result, after a year now, we are losing healthcare to other provinces because people can't just starve to death. So now we've got to the issue of the union, who is not protecting its members. So this is the thing I want you to think about. If we're in a position where the appointed directors of entities tell the employers what decisions they are going to do in regards to employees, and your union either chooses, I don't know if it's a matter of they can't or they won't. Either way, they have not stepped in to protect their members. We are now in a position where the union is actually not enforcing the collective agreement. And everyone's going into bargaining right now, and they're like, we're going to fight for better conditions. And you just go for it, because they will tell you whatever you want and make you feel good that somehow you were able to actually stand for change and get paid what you were due. But what I want you to be aware of is that in order for you to actually receive those supports and resources, there has to be somebody who will enforce it. And the nursing union is not. They are blatantly not. And if they will do that to us, you need to be aware that they are not going to do it for you. So we're in a time frame now where all of us have to decide, what do we really want to believe? What do we stand for? What are we willing to fight for? Because what I am seeing is that there is a push of authoritarianism over relationships that are supposed to have input from both sides and a respect to enforce that agreement. That is not occurring. And if it's happening to us, it's just a matter of time before that infiltrates into everything. And we're already seeing that because we've heard for years now that there has to be proper nursing ratios, all that kind of thing. And yet nobody actually enforces it. That's the point I want you to get. Who is going to enforce the accountability? Because it's not happening. So for nurses out there, I mean, what you have to realize is a union is not the executive council. The union is its members, and it's the people that are the membership that are the ones whose voices have to be heard. One way I can say that you can show a little bit of power is on a weekday when managers are around. You know what? You could just do rotating. Every unit calls in sick. And then you need to be able to show that you have some power, because right now you have given your power to a union that is not using theirs. And now we're in a position where everything is about to slowly fold. So, okay, I just want to see if there's anything else that I forgot about to tell you before I close this down. That's good enough. Oh, yes, I did want to tell you. So as a result, nurses now have just filed a complaint with the BC Labour Relations Board about BCNU. We are stating that they have failed in their duty to represent us. We have significant documentation to support that, but we'll see how far this goes. There are also 4 court cases that are occurring end of November that different healthcare groups are bringing forward. And we do have a website, bcnursesfightmandates.ca, and under the legal tab, there is a description of some of those legal cases that are going forward. If you need to contact me, I'm at stopmannow, all one word, stopmannow @gmail.com. And I am certainly receptive to getting any kind of information that anybody would like to send my way, because I make good use of it. Okay? All right. I'm hoping that was informative and useful. But you know what? We're just going to keep fighting here. Okay. Bye.